We're going to begin talking about the cardiovascular function, and this is going to be an introduction, and we're going to start off talking about the major determinants of cardiac function, and primarily the function of the left ventricle. And we can see that the major determinants of cardiac function include preload, afterload, and contractility. We can say that the preload can be thought of as the left ventricular end diastolic volume, so it's the volume within the left ventricle at the end of diastole, or the end of the relaxation period of the left ventricle. And we'll talk about later, and in more detail, what happens with differing preloads or differing volumes in the left ventricle during diastole, and how does that affect the ultimate cardiac output, that the amount of blood that leaves the aorta, or the stroke volume, using the Frank-Starling curve. And conceptually, we can think of preload as the stretch that takes place within the left ventricle during the diastolic phase, in which the left ventricle fills with blood as the blood leaves the left atrium and enters into the left ventricle. Afterload, on the other hand, is thought of as the wall tension, the tension within the left ventricular wall as the left ventricle contracts during systole, and it's the resistance that has to be overcome by the left ventricle in order to promote forward flow from the left ventricle into the aorta and ultimately systemically to all the vital organs. And that's considered afterload. And it's considered the resistance to shortening. The other major determinant is contractility. It's an intrinsic characteristic of the heart muscle, and it can be measured as the change of pressure within the left ventricle over a period of time. And it can be thought of as the actual shortening of the myofibrils during the systolic phase or during the contractile phase of the left ventricle. Other factors that also determine the cardiac function can be thought of as heart rate, which most often than not is due to the characteristic in nature of the SA node, which is the primary pacemaker. If a patient is in a sinus rhythm, the action potential and all the conduction is primarily started within the SA node, which is actually located at the junction of the superior vena cava as it enters into the right atrium. And there's an SA node, the sinoatrial node, that helps govern the actual rate of the heart. Rhythm we'll talk about later. Next we'll focus on the coronary circulation. Since the heart provides its own blood supply via the coronary arteries, we'll talk about the major factors of the coronary circulation, and we'll talk about the differing factors that determine the oxygen supply and the oxygen demand, and ultimately helps autoregulate the coronary circulation. And then lastly, we'll talk about the innervation of how the parasympathetic tone and the sympathetic tone come from the central nervous system. For example, the vagal or the parasympathetic tone comes from the medulla oblongata, and branches such as the recurrent laryngeal nerve and the thoracic vagus nerve actually innervate the dorsal and ventral cardiopulmonary complex, which ultimately give the right coronary cardiac nerve, left coronary cardiac nerve, and the left lateral cardiac nerve, which provides a parasympathetic tone to the muscarinic receptors on the SA node. And this helps to give the negative chromotropic and negative dromotropic effect on the heart function. So the negative chromotropic helps to decrease the heart rate, and the negative dromotropic helps to reduce the actual conduction within the Purkinje fibers. The sympathetic tone generally comes from the T1 to T4, which gives the cardiac accelerator fibers and ultimately innervates the beta-1 receptor within the SA node, and that helps to increase the chromotropic, which is the rate, the dromotropic, which is the conduction that takes place within the heart, and the inotropic effect, which basically increases the contractility of the heart. And to continue with the sympathetic tone, we can say that the vasomotor tone that goes and determines the venous capacitance and the systemic vascular resistance, we can think of it coming from the T5 to L1 fibers of the spinal cord, and that helps to determine the venous capacitance, or the venous return that comes back to the heart, and also the systemic vascular resistance that determines the afterload of the heart. So in the preceding lectures, we'll talk about each of these determinants in more detail, and we'll talk about differing factors that ultimately increase and decrease the function of the heart.